Hi, everyone, and welcome to the Harvard Business School Online Global Chapter. I'm Gwen Mdinaradze, the CEO of Speakers Alliance Canada, and in addition to my work as a consultant, CEO, and doctoral student, I'm also a proud and active volunteer here at Harvard. Back in 2019, I founded the HBS Online Global Chapter, and here we are today. I'm thrilled to say that over 5,000 global members are the part of our global chapter. I want to thank each and every one of you for being such an important part of our journey, and I'm always excited when you reach out to me or join the conversation with your questions, participation. So this conversation with Heather will be recorded and distributed through the YouTube channel or the newsletter through the Harvard Business School Online. And in case you want to reach out Heather or myself, you're more than welcome to do so. Today, I'm delighted to be speaking with Heather Weber as we explore her important role within the Canadian healthcare system. But before we dive in, I'd love to share a quick update on what's happening at the Harvard Business School Online and details about the upcoming conference. As many of you already know, Connext 2025 is just around the corner. This Saturday, the hybrid conference will bring together learners from across the globe to connect, collaborate, and engage with fellow participants and professors from Harvard Business School. With the theme Leading the Digital Future, the event will feature faculty-led sessions on campus, on the Harvard Business School campus, panel and case discussions at the Clermont Hall, and in iconic HBS case study rooms, and a variety of networking opportunities. I'm so excited because I'll be attending in person, representing the global chapter. As mentioned, I founded in 2019, and today we have over 5,000 global learners worldwide. And I'm so excited to be taking over the HBS Online Instagram account during the event. So I'll keep you posted on what's going on in case you're joining the conference virtually, because it's going to be a hybrid event. If you will be on campus, please stop by. There will be a community booth with all the organizers attending the conference in person. So I'll be one of them. Feel free to stop by the community booth and say hello. And now please join me in welcoming Heather Weber, educator, entrepreneur, and passionate advocate for integrating complex care. Heather, welcome to the community.
Thank you so much for inviting me, Gwen. It's a real honor to speak with you. You have so many incredible credentials, and those include your studies, but they also include all of this volunteer work that helps spread education and connect all of us globally. You're a real inspiration. I would say, as a person, you're also such an inspiring mom and wife to your young family. We're all juggling, and those things that we're passionate about, we make them happen, don't we?
That's true. Thank you so much for the kind words. Truly appreciate them. Heather, before we get into our conversation, can you please start by sharing a little bit about yourself, who you are, what you do, and then we can move forward with great questions that I prepared for you.
Thank you. Yes. So I have been a registered physiotherapist in Ontario for now 36 years. I was lucky to graduate in 1989 with 30 other students at that time, small classes and very few of them. The healthcare system has changed a lot, and I've been fortunate to work in a great variety of practice settings, hospital, home care. I ran my own private practice, therapeutic mobility, for over 20 years, which was truly one of the biggest learning opportunities of my life. I'm currently a newly elected professional board member for a regulatory body, the College of Physiotherapists of Ontario. I'm also a previous athlete who can catch airbuds before they hit the floor. Um, so at the present time, I am a board member, but I also am the owner of, as you know, the Physio Coach. So I mentor young healthcare clinicians in their businesses, in their careers, making the best choices for themselves and their families. And I also um, provide remote physiotherapy services and screening. So yes, I'm also a mother and a wife and a sister and a friend. I'm very lucky. I've had a very fortunate life.
That's amazing. So, so happy to hear that. Heather, you spent decades treating complex conditions. When did it first become clear to you that coaching, not just treatment, was what many patients truly needed? From what I've seen, treatment offer addresses the symptoms, but coaching seems to tap into motivation, mindset, and long-term change. And I've been studying mindfulness practices through Dr. Ellen Langer's course at Harvard, and the knowledge and new perspectives I've gained have been truly transformative. So I'd love to hear how the realization of what patients truly needed unfolded in your own practice.
That's a great question, Gwen. Thank you. Yes, and complex situations have always been something that drew me. I always wanted to be able to put a lot of pieces together. And honestly, most of us have many layers. Um, Honestly, the realization came in the early 1990s when I personally graduated. We all worked in hospitals and public health care until the delisting of most of physiotherapy services. And so it was retrospectively looking back and thinking, when I was in my first hospital job, I was surrounded by mentors. I could listen to how they spoke to patients. And we didn't have the time limits we have today. So we spent a longer time with each patient, getting to know them, getting to know how what they were feeling impacted their lives and what they were missing. And we also knew that the public health care was stretched, as it is more and more, and that we needed fewer appointments and to get people onto independence, which was the best thing for them and the best thing for society. So as privatization occurred, visit lengths decreased, things became much more structured. And I think if you look at your own life and how you've interacted with healthcare, one of the things we know is that we can be interrupted within the first 10 to 15 seconds of trying to tell a practitioner what we're experiencing. And that immediately cuts off trust. So it was really for me realizing that I had to build a circumstance of practice for myself and those around me that more greatly mimicked what we actually knew and practiced in the earlier days to give people time to tell their story. If you listen, these are some semi quotes. I never remember the actual quote. But if you listen to someone, and it doesn't take long, 2 to 3 minutes, you can actually usually have ruled out a lot of things and be able to structure the rest of your interview. You build trust immediately. And then in subsequent visits, the coaching process looks less didactic and more um, listening and asking open-ended questions. For instance, if I was working with a back pain patient, and we know one of the big risk factors for disc difficulties is smoking. And, so coaching someone in this way would be, how are you feeling about your current level of smoking? And tell me about what you're aware of, how it impacts your life. And usually people tell you they've tried to quit many times, but they may not be aware of what happens to the circulation in the disc with smoking. That's proven that we have it in evidence. So um, listening, um, helping them identify their own goals and objectives and small habits that they can add up to make changes is much more than I am giving you an exercise program that has 15 sheets of 25 exercises.
Wow.
Because we're clinicians, we're not just exercise therapists.
Right. And I agree with you when, from the patient's perspective, I feel it's truly important for the healthcare provider to, again, 2 or 3 minutes, as you said, right? It's not like hours and hours of listening, but the critical 2 or 3 minutes where they can really understand what is going on in our lives. I think it would change a lot of things. But as I know, I think there is 10 or 15 minutes window for each patient now, for the family doctors to kind of listen, diagnose, and finish the appointment. So I don't think it's a lot of time to really get to know the patient and truly understand what is going on in their lives. So yeah, I totally agree with you. And the next question would be again about the coaching. What does coaching look like in a clinical setting, and how does it differ from traditional models of care? I've noticed that coaching often empowers patients in a way that typical clinical consultations don't. And I'm curious how this plays out in your work and whether you see a shift in outcomes or patient engagement.
I see a shift immediately in going back to trusting that the patient can manage their lives. Because I think as medical people, healthcare practitioners, we sometimes feel a sense of power with our education and everything that we know that we can do, that we in very subtle ways and not necessarily known to ourselves, we take away their power, we take away their responsibility. And then what happens often is a judgment that the patient won't take responsibility and they haven't done their exercise program, and all of the different judgments that we know, at least I know internally that I've heard, and it doesn't do justice. So the beginning of the patient interaction it doesn't or shouldn't differ,
Mhm.
because the coaching is really a part of then when we begin a therapeutic relationship. So a thorough history taking, subjective, asking all the questions, letting them actually speak. So you need a long enough assessment time. And I believe a minimum of an hour for a new patient. This is in the physiotherapy world, the occupational therapy world. I definitely understand our primary care practitioners have their own limits and structure, but when we're coaching, then once we've identified what the problem list is, we've identified the areas that we want to interact with this patient or client. There are different words for that. The biggest difference, I think, is instead of going right into patient education, meaning your low back pain is here because you're sitting too long at work and you're smoking. And what you really need to do is this. And then we do something with them. We give them some exercises and away they go. It's much more, again, a conversation.
Mhm.
So the patient feels that you're on the level with them, you're listening. So it might sound something in the beginning like, thank you for giving me the opportunity to listen to what brought you here today. We've done quite a number of tests. I've observed some things that you've done, and um, is it okay if I tell you what I'm thinking right now, or some things that I've observed? And that's sort of a consent to the next conversation. And then, I've noticed a few things that we know through our research and experience that may have led to where you are now. If it's a obvious injury, then it's an obvious injury. But these are the things that I'm seeing that probably we need to work on. Um, how can you see in your life things that might get in the way of you being able to fit some of these things into your life? What are the things that you're stressed about? So that sounds like a real aside from what brought them in, but we're already busy.
Mhm.
And, they might have thought, oh, I should have been going to the gym. I would never have ended up this way. But how many of us, yourself, children, a busy spouse, other family members, just even keeping up with cleaning the house. People have busy lives. And so getting to know the barriers in their lives, the things that get in the way of them being able to get to their best health, sometimes they already know what they need to be doing. It's much easier than, you know, looking like I'm this big, powerful healthcare provider and letting them tell me what they think will help. Well, I really should get out for a walk after dinner, and I need to get up more often at work because I find that my pain at the end of the day is much better if I get up and walk. So letting them tell you what they think they can fit in, and then that's a great starting point. Um, and I never give people more than 3 movements, pain escapers. I don't always call them exercises because that's a trigger for some people that, oh, she thinks I don't exercise enough. So, we have some things that seem to change your pain. And I have exceedingly small ears that earbuds never stay in. I will change my headset if needed so that I'm not so distracting to myself and others. Um, so I think it looks much more like a conversation. And
Right.
the biggest difference is that it's a longer duration of an appointment, but in the end, my experience is less appointments, um, maybe a quick appointment a couple days or a week later after the first one to confirm that we're headed in the right direction, to answer questions that came up. But then they know what their deliverables are. When I
Mhm.
see you in 3 weeks, our goal is that your pain comes and goes rather than being there all the time by fitting these things in. And
Right.
then I really want to make sure that what I've tried to deliver makes sense to you. Can you just tell me in your own words what you'd tell your husband what went on today so that I know that you've got it? And I'm here for you in between if you have questions. So it's really making you feel like you are a team with that person rather than this whole hierarchy that sometimes gets in the way of the therapeutic relationship.
Right. Um, Heather, at the beginning of our conversation, you mentioned that you worked in both hospitals and private practices. From what I've seen, the disconnect between these settings can sometimes create barriers for patients navigating care. What have these environments taught you about the structural gaps in your healthcare system in Canada? Are there patterns you've observed that point to where we can make meaningful improvements?
Definitely. And there are models of care work very well. But if I would speak specifically to the different sectors, if I would think of a private physiotherapy clinic, for instance, um, access and being able to continue for long enough to have a full program of care can be difficult if you have no health insurance, if your insurance has a cap of 500 and you're a single parent, or your spouse just lost his job. So it's very expensive because the cost of doing business as a private practice owner is high. Their overhead is high. Their education costs a lot of money, and that's all in that interaction with the patient. Even though they look at it and say, "I can't believe that this costs $75. I'd like to have your job." Um, and so there's a lack of understanding on the part of most of the general public attending a private physiotherapy clinic. And there's a difficulty in accessing. If you don't have insurance, but you have a very high income, then you can go for as many visits as is necessary. Um, in the hospital situation, there is very little access to physiotherapy now under our public system in Ontario, unless you are under 18, over 65, you are post-operative total hip, total knee, shoulder repair, or you fit into one of the specific general chronic disease situations, different syndromes. There's one called Marfan syndrome. There's Ehlers-Danlos syndrome. Those are ones where people have more mobility than they should, so they have dislocations that affects their organs. There are programs for that that are publicly funded, but again, they're short-staffed. We're low on physiotherapists, and getting into them may take years. So by the time you get in, the level of your impairment is so much more than they can manage with the resources that they have. So that sort of public and private And then, just from a general access point of view, there are big gaps for people like single parents, especially if they have very young children and they don't own a car, they have very low income, people with mental health disorders, post-transplant people, post-cancer people, mobility challenges, our seniors. And so those are big gaps. And during the pandemic, we were able to prove that for many situations, not all of them for sure, remote care from an experienced clinician can give at least as much satisfaction for the patient, even though they didn't believe that it would, and to steer them in the right direction. So I think if we can have some triage systems where when people need care, there's a central type of triage that helps get them faster into something that they can access. And it could be provided by a nurse, a physiotherapist, there are many clinicians that could do a good job of this.
Mhm.
And we know we heard about a lot of healthcare in the last two elections and expansion of primary care practitioner teams and scopes of practice. And all of those things need to be addressed.
Right. Heather, in your work with chronic pain and complex cases, how do you navigate the emotional and psychological dimensions of care? From what I've seen, that emotional layer can be just as critical as the clinical one, yet it's often overlooked. So, what can you say and share about this?
What we teach as advanced care physiotherapists is, and a lot of the experienced PTs, the universities teach that although it is not directly our scope of practice to be treating mental illness or psychological illness, it is our job as practitioners with primary access. That means we don't need a doctor's referral to treat. We need the ability to be able to screen for all sorts of conditions that aren't in our scope of practice and need to be referred elsewhere. And mental health conditions, psychological situations, they are one of those things, as well as cancer and other things that we can hear in the history and the physical exam. So, um, when it comes to addressing these things, it's necessary because it's often a large part of the other physical impairments that they're experiencing, and they have to be treated as a whole. And I think in the past we did this better
Mhm.
when a whole team was in one place in one institution, and that doesn't happen as much now. And the time to communicate is difficult to find. So we have screening questionnaires and we have screening questions. Things like, have there been any times in the last 2 weeks where you felt significantly down? I would say all of us come along that way. Some of us mask it better. Some of us have had more trauma and more difficult life situations. Um, During my time running the clinic and also working at the transitional pain clinic at University Health Network, I was a part of a team working with people who perhaps were in a motor vehicle collision and someone was killed during that collision, or someone else became a spinal cord injury in a wheelchair and their lives were changed forever. And so I think sometimes as clinicians, physical treatment clinicians, we can get very nervous and go in two ways. We can either talk about that too much when it's not our scope and we might make things worse, or pretend that it's not even there and try to constantly redirect the patient back to the physical situation. Neither of them work. And that's why in the first assessment, really in complex patients, you have to review the background information so thoroughly and really know it, because otherwise you will not seem authentic to the patient and they won't know that they're in the right place. And then screening questionnaires that they can either fill out before they get to a clinic or an interaction with the assistance of someone else, their supportive person, can give you a lot of information of where they are at. And so we have lots of those, and they're very illuminating. They help us know how much more of a team do we need, and what resources does this patient have to be able to access those other team members.
Right. So you spoke briefly about your clinic. So you founded and ran a multidisciplinary clinic for 20 years.
Yeah.
What inspired you to take that leap as a woman entrepreneur in healthcare? It's not an easy path, especially in a system that does not always make space for bold leadership from women. What can you share about your experience as a woman entrepreneur? Would love to learn more as myself.
Thank you. Thank you. Well, in a class of 30, at the time we graduated, we only had 6 young men in our class, and 5 of them went on to clinic ownership, but I was the only woman in our class. And it was not something that I dreamed of. Um, I always dreamed of working with complex patients, probably some sport injury as well, perhaps some pediatrics until I had children of my own, and then I could not face that emotionally. But um, there were two main drivers to opening my own business. The first one was the need for family balance, and the other one was a value conflict that I was experiencing in other healthcare spaces. And it was 1995, and I had just had my first child, who is turning 30 this summer. And I was working as a regional manager for a large healthcare company based out of Toronto, and I was living north of Barrie. And having not had children before, I had no idea what it would feel like to be a mother. And so I had agreed to return after 2 months to this commuting, very hectic situation. And suffice it to say, that didn't work. That blew up. And I had already worked in hospital, another type of private clinic, and then this company. I had grown from clinician to manager to regional manager, and I wanted something different for patients. And that that's what drove it. And my husband at the time just was struggling career-wise. So not only did I need the flexibility to be with the kids and to do the things I needed to do as a mom, but I also needed a more fulsome income in order to support us. So that all happened very, very quickly, and but it just grew and grew and grew, and very proud now to have done that, to have brought it right to succession and to selling, because that's a very difficult and lengthy process.
Right. So you mentioned selling your clinic. What were some of the most rewarding and most challenging aspects of building and eventually, as mentioned, selling your clinic? I imagine there must have been moments of pride and moments of real uncertainty along the way.
All of those things, every emotion that you could imagine, because at the same time, um, I had 2 kids in, by that time, higher education. But during their school age years, I wanted to get to track meets, and I wanted to get to parent teacher interviews. I wanted to coach volleyball and soccer, and really remember their childhood. I wanted to be present. So I'd say the most rewarding things, that flexibility, that real fusion of professional and family life that collided and connected at the same time. Um, Top choice awards that we won from the community votes, hosting Georgian College and University of Toronto students, physiotherapy, and then from Georgian, the physiotherapy, occupational therapy assistant students. That was wonderful, sponsoring local teams and events. Having our therapy dog be a part of the clinic, and he's now almost 12. And having my team grow together and truly put the patient first. Hearing that was more important to me than any balance sheet anyone could ever create.
Wow, that's amazing. That's so
But the challenges, oh, where do I start? Um, Finding the best admin team. Your
oh,
front line is your bottom line, it's your entire existence. And but I mostly nailed it. And in my main administrative um, queen, I'll call her, she was with me for 18 years. We're still very close friends. Her name is Trudy. She had the link. She might be listening, but I could not have done it without her. Balancing all of the charting, marketing, HR, insurance changes and challenges with my own patient care role. I maintained a caseload the entire time. Um, and then at the times, mostly sole parenting. Um, I felt as though I had 7 children.
oh, I can.
Yes, and then selling. You talked about selling. It was a much longer process. Um, at the time, and for the last 15 years or so, most clinics are being bought up or integrated into the large healthcare companies. And I did entertain and sit down with both of those companies at different times, and got a fair bit along with one of the companies. But in the end, my intuition told me that I couldn't trust that it was best for my team and the patients. So it didn't matter what the offers or the other criteria were. I walked away.
Mhm.
Um, but I sold to another PT in 2015, and here I am now.
That's amazing. I'm glad it worked out well. And thinking back on that journey, how did owning a business influence your approach as a clinician and educator? And I'll have other questions about you being educator, but in this question, I want to ask, I always believe that running a business gives you a unique perspective that goes beyond the textbook. So I'll ask you questions about you being an educator later, but
Mhm.
now, how did owning a business truly influence your approach as a clinician?
Having already worked in and helped to lead in a larger healthcare company, I had already seen patients too structured and put in boxes that they didn't belong in. Um, and so realizing once I'm in there, the sheer scale of the workload and financial responsibility meant that I needed the best team around me. I couldn't do it all myself. And that was tough because some of us are born fiercely independent, and then circumstances reinforce that. So um, it influenced my work as a clinician because I had to become very good at balancing things in order to do both as well as I could. And it meant that I had to have other, really passionate uh, clinicians working with me that were also constantly learning because each patient comes with a unique personality. So, running the business myself, I had the power and the responsibility to the community that I was serving to hire the best people. But I also recognized that unless I was really loyal and honest and transparent with them and helped them along their success journey, I wouldn't be able to keep them. And turnover costs a lot of money, and most patients want to follow their physiotherapist if they go to another clinic. So, again, I've been so lucky that way as well. So, the workload, the costs, all made me really build a system and a team I could rely on.
That's amazing. That's amazing. And you got lucky because
Mhm.
it's really challenging to find the group of people who share the same passion. So,
Yes.
and as an entrepreneur, we have 85 consultants and trainers and 7 supportive team members, and I can relate how challenging it might be to find those around you who would work as hard as you do and who would share the same passion. So you're really lucky that you found that many great individuals around you. And
I just want to say that that took a lot of foraging in professional conferences, on LinkedIn, um, with our professional associations, with teaching at the university, because then I got to observe who the strongest people were in their interaction with patients and the chance to try to hire them. So yes, lucky and steadfast in finding them.
right. Now I want to move to your experience as an educator. You teach at the University of Toronto and Georgian College and have mentored internationally trained physiotherapists. What excites you about educating the next generation? I've seen how powerful it's when students feel seen, supported, and challenged, and I imagine you played that role for many.
Yes, and I no longer teach at Georgian College. I did for several years while I was running the clinic. It was really close by, but I have been involved with U of T as an adjunct lecturer for probably up to 20 years.
Oh,
And
hi.
in the Masters of Science in Physiotherapy program and the bridging program, which is the internationally trained ones, I love the diversity of learners. And I love that I learn as much from them as I hope that they do from me. One of the hardest things for me is sticking to the curriculum I'm supposed to teach. When all these pearls and all these examples from different patients that illustrate that over my career. So I really try and save some of those to the end for our discussion time. Um, and I'm passionate about making sure that they become great ambassadors for our profession, that not only do they understand the science, that I call it the art and science of the work we do, um, but also their responsibility to not create any harm in patients or in the system. So to be positive contributors and lifelong learners. Um, so I, I really uh, put my heart and soul into it and have enjoyed it very much.
Mhm. And you shared having a kind of hard time following the syllabus because you had so much more to share from your own experience. How do you balance teaching evidence-based methods with preparing students for the real-world complexity of patient care, considering, your experience? I'm sure there's so much more to share, additional to the textbooks and other materials. The gap between theory and practice, I feel, is so real, and I'd love to know how you bridge it.
Well, the great thing, at least at U of T, and I know it happens at Western and many of the other universities as well, is they have the PhD level professors who are building curriculum and, seeking out what the evidence is to be teaching to the students and what the proper teaching methods are and how do we scaffold these students to get from A to B to C to graduating. We like to use the term evidence informed practice now because the evidence doesn't apply to all patients, especially because we know when we read a study, there are always the people that didn't meet the inclusion criteria. And those people walk into our offices every day. So I like to make sure they understand, yes, it's important that we follow the evidence, but it doesn't tell the whole story, and sometimes it takes a little while to catch up. So, an experienced clinician who is keeping up with the evidence, um, it helps us uh, balance the real world of um, the patient is supposed to do foot exercises, but this person came in with a below knee amputation. And so that particular protocol doesn't apply to this patient and to help them think on their feet. So to use their clinical reasoning skills, learn the things that they learned and bring them in, but don't forget what the patient told you there in front of you. So that's really how we balance it. And I'm lucky to be an adjunct lecturer or status only appointment, it's called, at University of Toronto because I'm always current just by being able to read all the materials before I perhaps get online to facilitate or come into a lab. I see the new evidence all the time, and I see where the students are at this particular time in our professional history.
Right. I love our conversation and I learned a lot, but unfortunately, we don't have much time left to ask all the questions I had prepared for you. But I really want to ask you about the physio coach. What makes it different from other physiotherapy or rehab programs? It sounds like it's doing something fresh, and I'd love to understand the core philosophy behind it.
So there are probably three different components to what I do, and it's primarily virtual. I don't do at this point in my career a lot of in-person care. I feel that's helps meet the needs of myself at this stage of life, but also a patient who could be traveling or have chronic illness and accessibility requirements. So I mentor the new graduates and students in their professional path. That's one of the things that I do. And that is all pro bono because I really feel like they can't afford it at that point and they deserve a little hand up in a really complicated healthcare world. The second thing that I do is assess and screen patients virtually. And beyond that, we could coach to their rehabilitation process. But in some cases, in a lot of cases, people do need some in person. So once I know that patient really well and what their needs are, it's almost like a triage, like I was talking about before, where I can find the best person for them in their community. And then with their consent, I can even give some background to make the process a lot faster. Um, and then the third thing is I also coach mostly physiotherapy practitioners when they want to open a practice and help them understand everything that they need to know and listen to their journey and then coach them at any point along the way. It could be I'm having trouble hiring. I'm not sure which electronic medical record I should pick. Where do I find it in the budget to pay myself? And then I am ready to retire. How do I sell my business? So those are sort of the three primary areas. So very different from any physiotherapy clinic.
Right, but I feel like all those three components are extremely important for everyone who is starting or completing the physiotherapist journey. And I feel like what you're doing is extremely important as for a community, but as for your colleagues who are just getting started, which must be very stressful, or those who are closer to the retirement. I feel you're doing such important job for everyone around you. And I want to thank you, Heather, on behalf of our entire community here at Harvard for joining us today. I truly enjoyed our conversation and I look for this interview to be published very soon and distributed through the Harvard Business School online newsletter.
Thank you so much, Gwen. It was a real pleasure. Uh, it was easy to see I could talk about this forever. Um, but
Insane.
have a wonderful day, and I'm happy to speak to anyone that has questions.
Absolutely. Thank you and have a great day, Heather.
You as well, Gwen. Take care.